Welcome to our video on co-sleeping. The topic of where your child should sleep is a controversial one, with many different opinions and beliefs. In this video, we will be discussing the pros and cons of co-sleeping and whether or not it's a good idea for your child to sleep in your bed. We'll also be sharing tips and safety guidelines for those who do choose to co-sleep, whether you're a new parent or just considering co-sleeping as an option. We hope this video helps you make an informed decision about what's best for your family. So, let's get started. One of the main benefits of co-sleeping is the convenience and ease it can bring to nighttime feedings and diaper changes. It's also a great way to bond with your child and can help establish a secure and loving attachment. Studies have also shown that co-sleeping can lead to better sleep for both the parent and the child. However, there are also potential risks to consider when it comes to co-sleeping. For example, there is a higher risk of sudden infant death syndrome, SIDS, when a baby sleeps in the same bed as an adult. It is also important to consider the comfort and safety of both the child and the adult, as well as the potential impact on the child's independence and development. It's important to note that it is not recommended to co-sleep with children who are at a higher risk of SIDS or children who are over the age of 2. If you do decide to co-sleep, it's important to be aware of the risks and take steps to minimize them. This includes using a firm, flat surface for the baby to sleep on, such as a crib or a co-sleeper, and avoiding pillows, heavy blankets, and soft bedding. It's also important to avoid alcohol and drugs, which can impair your ability to wake up and respond to your child. It's also important to make sure that your bed is free of any hazards, such as loose bedding, wires or cords. Another important aspect to consider when co-sleeping is your child's age. While co-sleeping is generally considered safe for newborns and infants, as they grow and develop, it may become less appropriate. As children grow, they may move around more during their sleep and may roll over or kick, which can be dangerous if they are sharing the bed with an adult. Another important point is to make sure that your bed is big enough for all the members of the family. If you have a queen or king-size bed, it's probably big enough for you and your child, but if you have a smaller bed, it's important to consider if it will be a safe and comfortable option for you and your child. It's also important to consider the impact that co-sleeping may have on your relationship with your partner. Sharing a bed with a child can be disruptive to sleep and intimacy, so it's important to have open communication and make sure that both parents are comfortable with the decision to co-sleep. Remember that everyone's situation is different, so it's important to consider your own personal circumstances and what works best for you and your family. It's important to be flexible and open-minded, and to be willing to change your approach if it's not working for you. In conclusion, co-sleeping can be a great option for some families, but it's important to be aware of the risks and take steps to minimize them. Ultimately, the decision of whether or not to co-sleep